We are going to be talking about interoperability of devices, which are getting ready for prime time, big testing here at the Connectathon today. I'd like to introduce our moderator, Todd Cooper, who is the Executive Director of Breakthrough Solutions Foundry and an active member of the International Devices community. Friendly reminder that our tour will begin promptly at 11:30 because we are stopping some testing in order to bring the tour to us. So Todd, I will pass it over to you.
All right, and my colleague Monroe, who will come at the end, and especially important is because what Monroe presents to you is exactly what you'll be seeing when you go on that tour in a few minutes. And the one other thing is just to say regrets from Stefan Schlichting, who came down with a cold and lost his voice, so he can't join us today. But we'll go through this very quickly, and I think you'll find it compelling with what you'll then see. So next slide. All right. And there's animation on this, so keep up. Good luck. The first thing I want to say is that IHE PCD was created in 2005. So we're almost coming up to our 20-year anniversary here with our first Connectathon in 2007. So we've been working on this for a while. Today, the #1 standards-based solution for device to enterprise integration is the IHE PCD profiles. There's no competition. It's been extremely successful. So this 15-year success story is really centered on what you'll see being tested down on the floor today. And then in 2019, though, we reorganized the domain internally. Externally, it looks the same, but we have one harmonized technical framework. But with IHE devices, we have 3 program focus areas now. So PCD is still the PCD program that it's always been, but we also brought in PCH for mobile and home applications and acute care beds, device to device point of care interoperability, DPI. So what I'm going to focus on today is the DPI stuff. And then Monroe will come and really give you a good overview on PCD and I think PCH a bit too. So next slide. Okay, so this is what I'll focus on first. Next slide. And we'll introduce what SDPI plus FHIR means. With a lot of acronyms, device to device, plug and trust interoperability. So we'll introduce those. Next slide. Yeah. So it started as a Gemini project in 2020. Gemini, that's a joint IHE HL7 projects where we work on them together. The items get published together. They're developed together. And so we started that in 2020, before we knew the words COVID and pandemic were present. But we've been able to keep through, and we're very happy to say that the version 1.1 was published just before the HIMSS conference last year. We're about to release 1.3 just before the HIMSS conference this year. We're looking at quarterly updates. So this has been a very, very successful collaborative effort between IHE and HL7. Next slide. And for the standards that we're focused on, the SDC standards, which in the device world means service-oriented device connectivity. Sorry for the confusion. It's been a 15-year journey as well. And so this has been being baked with a lot of projects and experience, especially in Europe. But that timeline roughly parallels the devices group within IHE and within HL7. So this has been a parallel journey that has come together in these SDPI profiles. Next slide. So let me give you an example. If you've ever been around an ICU or an acute care bed, you know things can get pretty noisy. And that noise is a challenge not only for the individual, the patient in the bed, but for healthcare providers. And they're trying to figure out what is all this noise from all these different places. What if you were able to intelligently reduce those alarms and distribute those alarms to the one primary or just a few primary alarms to the patient, to the clinician for that patient, to where, as you see in that tomorrow box, the patient can sleep. It's silent within the ICU bed, and the right clinician gets the alarm or the central station. I mention this because one of or two of the demonstrations you'll see at the Interoperability Showcase in Florida in a few weeks will be around exactly this use case. Next slide. This use case is built on some very special capabilities provided by the SDC ISO IEEE standards. Next slide. Focused on silent ICU using those. I won't go into detail on this, but let's just say that the whole concept of alert delegation, where you're actually able to have a device, a medical device, a regulated medical device that is able to safely and effectively and securely delegate the enunciation, the signaling of an alert condition to other systems, enables us in a plug and trust ecosystem to be able to enable a point of care to be silent, but not to compromise on security, on safety, and effectiveness. Next slide. So very quickly, this is what we're talking about for these standards, point of care. So the green on the below part, this is really what we're focused on in this device-to-device plug and trust point of care ecosystem. We're very familiar with the enterprise integration. And as I show there, typically we have gateways. Today they're proprietary gateways, but they do use the IHE PCD profiles. So what we're looking at is gateways for based on HL7 version 2 and FHIR, as well as the IHE devices PCD, I'm sorry, I got that wrong. PCD, DEC, and ACM profiles. Monroe will go into that more later. But this bottom point, and if you can click again, is really what we're talking about here. And notice the logo, HL7 IHE service-oriented device point of care interoperability profiles, device-to-device connectivity. Kids, we've been working on this for 40 years. So this is really exciting for me to be able to get to this point. Next slide. So the profiles, as you'll see here, are organized according to a standard IHE technical framework. We have the 4 profiles. One is for basic plug and trust connectivity, but then we also have a profile for medical reporting, for alerting, and for external control. And they're all in various phases of implementation and standardization. But notice the connectivity to the standards underneath. So we're actively working on a FHIR-based gateway for this information. We're leveraging the DEC and ACM profiles that are already in use. We're leveraging these standards, these core ISO IEEE standards for service-oriented device connectivity. So it's a profile, a standards profile, but it's built upon this established base. And that's the current technical framework. Next slide. So 4 profiles. We're doing something a little bit different though here. First off, like the rest of IHE and many standards groups, we're moving toward automation of the development process using GitHub. So we have a GitHub repository. The URL is there. We use it for the project management, for the source code management, for creating this specification. We generate HTML automatically out of that. We actually also generate JSON-based requirements extracted from the metadata in the specification. And since this is a joint Gemini project between IHE and HL7, this dev.sdpy repository is mirrored into a repository in HL7 dev.sdpy. So everything is very much automated and coordinated between the organizations and actually using tooling that is used by all of our technology software development teams in the organizations that do this. So this is fantastic advancement for how we're developing this. Next slide. As I said, the actual content of this is crafted. We're using a markdown language called AsciiDoc, but this is an open source tool here. There's lots of them that you can use. What you see in the middle is actually the content that we author the specification in, and it automatically renders what you see on the right. And we, through automation, can actually render the actual HTML document which gets published. Just to show you that that is how we're pulling these pieces together. Next slide. Using computable content. Next slide. And this is what it looks like. There's the URL at the bottom. a standard IHE technical framework overview or organization here. And if you go to that URL, you click on this, it'll come up in your browser, and you will be able to search and find all of the specifications. But under the hood, like I said, there's metadata. So next slide. And that metadata includes requirements. So click again and click again. So first off, you notice that this was revised mid-December, and that's version 1.2. 1.3 we're anticipating for coming out, like I said, in a few weeks before HIMSS. But notice also in that red box at the bottom, an SDPI requirements compilation. We are able to actually pull that out of the specification, and then you can take and integrate that with all of your conformity test tooling to be able to link specific requirements in the spec to specific test cases, to specific test reports, and thus be able to close the gap between between requirements and testing, and show coverage and test completion. And we're, as I said, always looking for quarter releases. This here is where you can always find the most recent one. Next slide. Security is foundational to absolutely everything. And so we use SDC communications. This ISO IEEE uses TLS. I won't go into the details on this, but the bottom line is there's enough open to be able to discover there's something out there. But absolutely all the communication between this device-to-device system is secure communication. And that enables us to be able to do what we call trusted interoperable product decoupling. The way this works is you could actually have products developed in different places, not in conjunction with business agreements, and have them whenever they are plugged into a subnet, be able to automatically detect and connect, exchange the certificates and security certificates, and recognize and have trust in what this other entity is. So I just wanted to say security is foundational at the very beginning of all exchanges. Next slide. So another piece of this, though, is if you're thinking about regulated medical technology, then you're going to say, okay, well, technically, yeah, we've actually over that 40 years solved the technical problem many times. But how do you actually address the quality, the V&V aspects of this, and especially when you're talking about life-critical acute care devices like a ventilator, and be able to get that past a regulatory paradigm. So here's an example. This is an example straight out of a pandemic scenario where you have a ventilator that provides a function, and you have an app maybe running on a central station or some other system outside of the point of care, and you want to adjust some settings on that ventilator. This is a specific kind of use case that this SDC SDPI is really targeted here. Notice the certificates that will enable them to understand what are the services provided and how do I consume them. Next slide. So doing that, when you look at the V model, and any of you who have worked on medical technology, V&V, validation and verification, are familiar with this model. But notice what we've done. It's not a single product or a few products from a single vendor. We've actually looked at this as a system of products, each product providing their own service capabilities into the overall system function. And so you see these multiple lines where you have the requirements that are integrated on the left and then validated on the right, all the way up to a system of products in a hospital setting. So this is, we are looking at this model, but we're specifically looking at how does an interoperable plug and trust system of devices follow this model in terms of requirements and in terms of V&V. Next slide. Oh, I'm sorry. I should have said click. Can you go back? There. And notice that the SDPI plugathons, we've been doing plugathons every other month for years. Our 16th or 17th plugathon is next week. Our 16th is next week. We have them every other month. So as Lapo talked about earlier today, that gives you an opportunity to really kick the tires, make sure the technology works, try out test tools and test sequences. But we're looking to do connectathons, just like what you'll be touring here in the very near future. We're looking to product conformity assessment and actually doing projectathons for real world projects that provide that framework. Those testing events provide the framework for the system of products V&V that we've talked about. So there's a very tight IHE story within this. Next slide. And this is just another example here of how on the other of the specific device A, I think that was an app and a patient monitor and a ventilator working together to provide specific clinical system functions. But notice this, the FDA right now, we're very actively talking to them about recognition of SD-PI. They've recognized the core standards for this device interoperability, the SDC standards, service-oriented device connectivity, but they recognize that actually the products that are submitted to them will have testing. We are calling it regulatory submission-ready test reports that we anticipate coming out of IHE connectathons and especially conformity assessment. They want to recognize SD-PI for this capability here. Very active discussions, and we're looking forward to hopefully giving them a tour. They're very interested in seeing what's coming up in the interoperability showcase in a few weeks. Next slide. And so last slide here, as I said, the showcase is coming up. There are 2 SDC, SD-PI focused demonstrations. You'll see real world devices. You'll see systems from competitors in each other's booth interoperating. That's always kind of fun. And so if you're able to make it there, please check them out. And then the last piece is we have an ecosystem pathway summit coming up at Vector Informatics in Stuttgart the end of March. We have technical solutions, but there's a lot that has to happen to actually get product to market. And so with that, this is a group of those who are focused on product quality, regulatory affairs, risk management, coming together to put together a multi-year roadmap for how do we put all these pieces together and actually create that ecosystem of plug and trust products. So a lot going on there. And but for today, Monroe is going to give you a little tour, a preview of what you're going to see in a few minutes. So Monroe.
Thank you, Todd. So within the IHE devices domain, you heard about patient care devices or PCD. That's the profiles I'll predominantly focus on, but Todd covered the DPI. There's also the PHD, which is personal health care devices. And those are all the things you go buy at a store and attach and do sports medicine and doctor recommended sort of monitoring of yourself. And those all roll up into the IHE PCD profile. So that's what I'll predominantly focus on. Next slide, please. So PCD within Dev focuses on the interoperability between devices and devices, devices and systems, and systems and systems. Number of those solutions are gateway based, so they'll take in one standard and spit out an IHE profile based standardized form of communication. It's not limited to just being wired or Ethernet connected. It can be wireless using different protocols, local networks, public networks, the open internet. It's agnostic as to the transport. We also include alert or alarm management, as well as medical device equipment management. Like I said, we were formerly known as patient care devices domain. We added personal health care devices. We have a long list of recognized standards that we make use of. For example, IEEE, predominantly 11073, like -10101, -10201, just a long list. ISO standards, 80001-1, etc. HL7 based standards, predominantly version 2 or started as 2.6. We're now up to 2.8.2. We're also working on changes for 2.9. fire-based as well. And sometimes we'll have certain actors that will be able to both receive fire requests as well as HL7V2 requests and do all the back-end processing. SOAP-based, as you heard about SDPI, SOAP-based, to communicate outward from the medical device community to the broader like mobile devices and smartphones and such. We utilize WCTP, and if you recognize the acronym, you know what I'm talking about. But that's a very open standard for us to be able to do that. We have made extensions to it, which requires us to take ownership of the current version, BL 1.3. The normal internet stuff, all the IETF, there's a long list of RFCs there, but we're also aware of the other communities that have standards for nomenclature like SNOMED CT, LOINC, and UCUM. We have a technical framework. The technical framework for the devices domain includes all those profiles that are mature enough to have achieved final text status. And for tools and for a repository of the nomenclature, we rely exclusively upon NIST. They create and maintain the tools and enhance and expand the tools, as well as keeping a open, free access repository for the nomenclature. Next slide, please. So this is the laundry list of profiles within PCD, within Dev. And we start with, if you want to communicate patient data from devices to an EHR and EMR, that's the Device to Enterprise Communication Profile, or DEC. That's kind of a fundamental backbone. If you're doing infusion, various types of infusion devices, there is the point of care infusion verification, where an order comes in, it gets communicated to an infusion system. The infusion system interacts with the actual device, the pump, whether it be a syringe or a bag, and then also interacts with the clinician associated with that infusion order to confirm that the order that is being presented to the device for the appropriate patient in that bed is the one that you expect and gets confirmed. That will then roll up, and as the infusion progresses, events will occur, status changes will occur. Those get communicated out using infusion pump event communication, or IPEC. If you happen to have an implanted device, be it a pacemaker, defibrillator, and looking to additional implanted devices in the future, there is the implantable device cardiac observations, IDCO. They're mature enough to almost run freestanding within the PCD domain, but they'll occasionally do connectathons. And then all the forms of alerts that go to people, be it clinical staff or others within the healthcare ecosphere. Those alerts can include things like alarms, alerts. The alarms can be physiologic or technical, and those all go out through ACM, through Alert Communication Management, in order to abstract the originating device from how it actually gets to the person, how the person responds, and whether the person on the other end did an accept of the alert or a reject, or just timed out and you had to escalate to somebody else. And then we've added into that medical equipment management. You have systems that will manage the actual medical device, its battery status, its test status, its calibration and use status, and all of that information now has a profile MEM DMC for device management communication, as well as all of it started out as location tracking, RTLS, RFID, those kinds of things. But that mechanism has broadened into other forms of sensing. Like they found that if the tag has a temperature sensor in it, you can throw that in a refrigerator and monitor the status of your refrigeration or your freezing unit just by getting periodic data from the tag. Boundary crossing, when a patient that's supposed to be confined to a particular ward, when they breach that and go elsewhere. We also do monitoring of risk assessment of the person wearing a tag. So falls, we do fall monitoring in that regard. So all of that is rolled up under MEMLS, and we've been working with the IEEE location services in healthcare to use MEMLS as kind of the standardized way of communicating all of those things. Next slide, please. And then the sort of underlying things that we make use of for communicating. So instead of modifying each profile specifically for waveform content like ECG, we come up with things called modules. And we have a waveform content module that is used both by the DEC and the ACM profiles as a common means of communicating waveform data, initially and focus on ECG or cardiac rhythms and how to get that into the record so that when a clinician gets an alert on their mobile device, it not only says, I think I've got a cardiac issue with this patient in this location, it'll give you a waveform snippet to say, oh, that's just a leads off. I'll get to that. Or that may be in a systole. I better run to that. So that's the reason for communicating that, as well as to get into the patient information, the patient records. PCIM is our latest effort. That's point of care identity management. Think of it as device assignments. So if you want to assign a physiologic monitor or an infusion device to a particular patient, then you need to know, well, what devices are available for this particular care unit at this bed. The clinician gets involved, much like PIV, and confirms that, yes, I am indeed assigning this device to this patient. And then you can make use of that assignment's stored information for other profiles. And also, like I said, PhD personal healthcare devices, the profile that they use for gateway of uploading the data that they've collected is PhD observation upload, or POU. The actual nomenclature, the specific observations, be they just physiologic, technical alerts, alarms, all the units of measure and enumerations of values, those are all part of our Rosetta terminology mapping working group. Not really sort of a profile so much as a means of communicating common terminology across all the profiles. And those are focused on IEEE 11073, 10101, which is the recently updated nomenclature standard, as well as 10201 for device virtualization. And all of the data items within the RTM based standards are available for open access provided by NIST through a system called RTM Management System, or RTMMS. And that is actually the nomenclature that the Connectathon testing monitors use to confirm that is that the right way to communicate that particular observation or event. And also we use the NIST test tools as testing monitors to look at the data that was communicated between the systems and confirm that that actually is in conformance with the particular profile. So being the last in the groups and the last speaker of the group, getting it right down to the wire, so to speak. If there are any comments or questions, my email is easily identifiable. It's just monroe.patillo@gmail.com. But I currently manage the IHE devices domain medical equipment management working group. I formerly did the alert management working group. Rob Wilder of Spoke now does that. But that's where we're at right now. Thank you.
Excellent. Thank you, Todd and Monroe. We do have some time for questions. Do we have any questions? Or Todd, if you would like to ask any questions at this point, please feel free to do so.
I think let the fun begin. I did note, and I just see I got it messed up. But for that POU profile, that's Fire-based, and so it actually takes observations that were collected from a personal health device ecosystem and uses Fire to be able to get to that cloud-based system. So.
Yes, and if you read through the technical framework, you'll find the DEC profile has an appendix that allows essentially SOAP-based communication of PhD information up into a DEC consumer to put that in the personal health record as well. So we have two approaches to doing that.
Well, thank you very much, Christina.
Excellent.